ನನ್ನ ಹೆಸರು ಡಾಕ್ಟರ್ ಶಿಲ್ಪಾ ಅಂತ ಇಲ್ಲಿ ENT ಸ್ಪೆಷಲಿಸ್ಟ್ ಆಗಿ ಕೆಲಸ ಮಾಡ್ತಾ ಇದ್ದೀನಿ. ಇವತ್ತಿನ ದಿನ ನನಗೆ ಡಾಕ್ಟರ್ ಜ್ಯೋತಿಕಾ ಕ್ಲಿನಿಕಲ್ ಹೆಡ್ ಮತ್ತು ಡಾಕ್ಟರ್ ಪವನ್ ಮಾರ್ಕೆಟಿಂಗ್ ಮ್ಯಾನೇಜರ್ ಅವರು ಈ ಸೆಷನ್ ರಿಕ್ವೆಸ್ಟ್ ಮಾಡಿದ್ರು, ಈ ಸೆಷನ್ ಮಾಡಿ ಇವತ್ತು ಇಲ್ಲಿ ಅಂತ. ಸೊ ENT ear, nose, throat related any conditions, like I would like to give an awareness a talk about it, like what are the common ENT conditions we come across in adults as well as children. And you can ask me any questions if you have any doubts related to it. You're most welcome to ask. So basically, as this is summers, ಈಗ summers ಆಗಿರೋದ್ರಿಂದ childrenಗೆಲ್ಲ ತುಂಬ summer holidays ಇದೆ. ಹಾಗಾಗಿ because they love swimming, children also put the parents also put the children for swimming. ಸೊ ಇದರಿಂದ ಸ್ವಿಮ್ಮಿಂಗ್ ಕಂಟಿನ್ಯೂಸ್ ಮಾಡೋದ್ರಿಂದ ENT ಇಯರ್, ನೋಸ್ ಮತ್ತು ಥ್ರೋಟಲ್ಲಿ ಇನ್ಫೆಕ್ಷನ್ಸ್ ಆಗೋ ಸಾಧ್ಯತೆ ಜಾಸ್ತಿ ಇದೆ. ಸೊ ವಾಟ್ ಆರ್ ದ ಪ್ರಿಕಾಷನ್ಸ್ ಒನ್ ಕ್ಯಾನ್ ಟೇಕ್ like when you are sending your children for swimming? That is more important. Like do people have any awareness like what precautions you have to take, like when you send your children, or what's going to happen if you if you're not taking any precautions, what's going to happen?
You can say what precautions to be taken.
Okay. So the children, like by daily going for swimming, their ear will be exposed and also their nose will be exposed for the water, and there is chances that the water can get collected in the ears. Also some children, they can get cold or runny nose because of the swimming problems. So in that situation, like it's better you people get the children's ear checked before sending them to swimming. So one most common ENT condition in ear is wax accumulation in the ear. The children who are born with narrow canal, like ear is a very small structure. We cannot see. It's a very small structure, and some children will be born with narrow canals. So anta makkalli wax collect agbidutte kiviyalli. So if they go for swimming without getting their wax cleaned, water can get accumulated in the ear, and it can block the it can cause ear pain or blocking sensation of the ear, and also some infection in the ear. So that is why it's better you get ears checked from the ENT doctor, and if wax is there, get it clean and then send them for swimming. The second thing is also it is advisable to make them wear earplug. It is available on many, even in the pharmaceutical stores or from the Amazon. So you can make the children wear the earplug and also the swimming cap, and then send them for swimming. And the third thing is, once they come back from swimming, you have to see to it that there is no water in the ear. Like you can use the air dryer and blow the air and make it water should not be there in the ear following swimming. So that precaution can be taken. And the other problems like ENT problems are there is a tube which connects nose and the ear. So whenever the water gets collected in the ear, the tube, the middle ear, the ear is divided into three parts: outer part, middle part, and the inner ear. So always the middle ear can get infected because of the water accumulation in the children, and that can cause ear pain because there's a tube connection between the nose and the ear. So that can get infected and edematous, and can block cause infection in the middle ear. So that is called as otitis media. So such things, please don't neglect. You can show it to any ENT doctor and get it checked, because I've seen many people, they just go to pharmacy and take medicines. Pharmacy or kottidda drops, ear drops and all, they keep using it, but that can damage the ear. They are not the ones who diagnose the ear problem. So better you go to ENT doctor and get the ears checked and take proper medicines. So, and children can also have tonsil problem, like when they are born, there's tonsils in the throat that can cause throat pain and recurrent throat infections. So in that time, better to take them to ENT doctor and get it checked. There's also one mass behind the nose called as adenoid. It is very common in 5-year school growing age group. So that can cause a lot of mouth breathing, nose difficulty in breathing through the nose, and throat pain, all that. So better don't neglect and get it checked from the doctor and take medicines. The fourth thing is hearing. Somebody in the elderly age group, they'll have difficulty in hearing. As the age progresses, their hearing also comes down. So we have a lot of hearing tests for that, and also there's hearing aid. So that can be given. So get it checked. And yeah, we have allergy tests also. There are so many allergy tests now to we can assess the allergy problem in the nose as well as in the throat and the ear. So the facility is there in the center. And also we do endoscopies here. All the endoscopies of ear, nose and throat for difficulty in swallowing, painful swallowing, all that. So any questions you have? Any doubts or something?
After every day's class, you would spend some half a minute on the prior.
Yeah, just after finishing the swimming, make sure that water is not there in the ears, because if water is there, it can lead to decreased hearing, ear pain, middle ear infection, and because of that, there is a eardrum which is between the middle ear and the outer ear. Over a period of time, even that can get perforated, like a hole can happen in that eardrum because of repeated infections. Some people snore when they sleep at night. The partners say, the one who is sleeping, he's snoring, we are able to hear. For that also we do evaluation in our center. So you can get endoscopy done for that, like nasal endoscopy. We do a endoscopy for the nose, for snoring problem. Somebody who's, when they're sleeping, they sleep with a loud noise. So for that also we do evaluation in our center. We do endoscopy for the nose, ear as well as throat. So
what about the cleaning mechanism for ear and tongue? People, doctors say that it's a self-cleaning thing, but some say that you have to do it regular.
Yeah, wax is a problem which doesn't happen in everyone's ear. Only the people who are born with narrow canal. Some people's canal will be very narrow. When they are born only, it will be very narrow. And in some people, though the canal is not narrow, not very narrow, in them the cleaning action of the wax, it itself comes out of the ears. When they are taking bath, the water itself will push out the wax outside the ear. Such people, they can manage, but in the people who have accumulation of wax, they have to visit a ENT doctor and get it cleaned. And there are different methods of cleaning also, like wax cleaning, we do it in a different method. So depending upon how hard it is, we prescribe some ear drops and then do the cleaning. Butt should not be used, yeah. Because if you use the butt, you'll be pushing the wax more deeper, and that will cause ear pain. And also it can damage the eardrum which is there. That is why.
There's to put the ghee in the nose, right?
Ghee?
Yeah, is it medical ghee? Is it a good method?
For what reason ghee?
Just for better safety.
No. Ghee we cannot put like that inside the nose. We can use olive ear drops or this coconut oil drops for itching in the ear. Like we can just use that because it has an antibacterial action. That we can use, not ghee and all in the nose. Like in the common problem in the nose is allergy. Most of us will have allergy problem in the nose, though when we get exposed to AC or when we get exposed to dust. Such people will have allergy in the nose and they'll repeatedly sneeze in the morning. They'll have a lot of runny nose, sneezing in the early morning. That is called as allergy in ENT, like allergic rhinitis. For that we do evaluation in our center by getting a blood test done. Through the blood test we can find out if you have some genetically inherited problem, and there's treatment for that, like medications are available. But if it is an inborn problem, mostly allergy will be a familial, they have a family history. In those who have a family history, it will be a lifelong problem. Only by taking precautions we can minimize the problem. Precautions like whatever some people are allergic to certain foods, so we have a food panel test. In that we can make out which foods we are allergic to. Like some people are allergic to potato. If they eat potato, or if they eat wheat, or if they eat some tamarind or something, they get sneezes and runny nose. So with that food panel test we can find out which foods we are allergic to. They have difficulty in swallowing, difficulty in breathing through nose, and the other ENT problems are ear pain, decreased hearing, ear discharge. All these problems better to go and show to ENT doctor than taking medications from pharmacy.